Most patients who require total joints are of an elderly population, therefore they have health risks that make them slightly more apt to have certain problems after surgery. There are certain things that are modifiable and certain things that aren't modifiable, so we try to focus on the things that we can change. A lot of things we can't. Obviously, patients have heart issues, lung issues, and we try to optimize those as best as possible. But things like diabetic control, weight, obesity problems, those are things that we try to control and help, and those help to optimize our patients to have better outcomes. We usually send patients to an optimization clinic that's run by a team of physicians and nurse practitioners. They diagnose problems that these patients may have using a combination of physical exam, lab work. We have shown that optimization has a huge impact on patients. We've reduced infection rates threefold. We've reduced readmissions to the hospital due to medical complications by 50 to 60%. So this optimization has really shown to benefit patients and benefit us as well.